No, I think that the way we want to do it is two things. We want to make sure that if they commit, and if the Quebecers commit to invest in those doctors, they need to know ahead of time, over 6 years, 8 years, then when they finish their study, that they will be committed to 5 years. That's very clear. If they're committing to do it, and at the end they change their mind, but the consequences will be very expensive.
But for those who are already students,
for
those who are already studying medicine at the moment, you mentioned that you'd still like this to apply to them as well, people who are already in the
Well, we'll find a way,
system.
and that's the reason the question I was asked before. When we do a bylaw, as we do a bill right now, we give the principle. We say, this is where we want to go. We want to reinforce the public system. Now, how are we going to implement it? I think it goes by rules. Those are the règlements. And I think those règlements... Regulation? Thank you.
Okay. I understand that part, but why would it be important for you to apply it to these students as well? This isn't exactly what they signed up for when they went to medical school, right?
Yeah,
so why include
But
them?
I think there is a principle that I think most of them would agree that they need to practice. Sometimes you do bills, you do des projets de loi for those maybe that don't want to respect the rules. So this is the sort of discussion we'll have.
Definitely for the new doctors, you want to impose a sense of social duty.
Yes, it's very clear. I think that the issue that we have, and we have that with the doctors, we have that with the nurses, and this is the reason we went after the agencies. Right, you know, the people could, the nurses could go without, you know, making sure that they can go in an agency and practice the private. Nobody said that was not the right thing that we did. We have made very clear that they should come back into the public system, and that's exactly what we want to do with the doctors as well.